Hi. So today is the day before surgery. I weighed myself the day I was supposed to start my pre-operation diet and I weighed 131. And then I weighed myself yesterday afternoon and I weighed 123.5. So altogether in 2 weeks I've lost 7.5 kilos. Today I had my last meal at 12. Obviously still sticking to the guidelines. I just had a salad. They say not to eat after lunch. You can still have shakes, but I just couldn't be bothered to really have my shake. I found that like following what they've asked me to do, I'm not actually as hungry and I eat a little bit and I'm full. So yeah, I can't be bothered to have the shake, so I've just been drinking lots of water, which is what they tell you to do. And I have operation at 7 in the morning and I can't drink from 5 in the morning. So obviously 2 hours before, they want you to stop everything. So I'm pretty happy with losing, a little bit before the surgery, because it means I have a little bit less to lose overall. Yeah, that's pretty much it. So I'll keep you updated as to what happens after the surgery. Hopefully I survive. I'm a bit nervous. I'm a little bit nervous because like I said, I've never had anything like this before, but I guess it should be fine. Hopefully the drugs are good and I don't feel anything or I stay asleep. Yeah. Anyways, yeah. Bye.
2 o 3 semanas solamente líquidos.
Líquido.
Sí, ahora hielo, después líquido, nada más.
Bueno, pero líquido.
Por 2 o 3 semanas. Después empieza con batidos.
Sí. Pobrecita.
Oh my God, todo el día está pobrecita, pobrecita.
So I've come back from hospital. Today's my first day back home, and I just wanted to do like a little catch-up video on the surgery and being in hospital. I really wanted to record all of this like when I was in hospital and even just before the surgery, but unfortunately I was in the room with an old biddy next door and she was a bit of a prune, so she wouldn't have been happy. I went to the hospital at 7 a.m. And then I filled out all my paperwork and everything, and then went to fill out all my paperwork, and then they gave me a blue a gown, and then they gave me some compression stockings, which is the really, I don't know if you've ever seen them, they're the white stockings and they're really, really tight on your legs. It helps with blood flow and stuff like that, so they want you to have those on during surgery. And then I was taken through to the room before the theatre room, and I met the anaesthetist and the surgeons and everyone who would play a part in this surgery. I had questions for the anaesthetist because I don't know why, but I was just worried that somehow I would wake up halfway through the surgery when they were pulling my guts out. And I laid down and he was he had some fluid and popped it in and said that this is going to make you feel fuzzy, and I was like,
whoa, this is like making me feel fuzzy. So
I was out of it, and then I woke up and there were people all around. There was probably only 2 people, but it felt like there was people around trying to talk to me and ask me questions. I don't know what was going on. I was out. They said that the surgery would go for like an hour and a half, which I don't know if it did. It could have gone longer or shorter, I'm not sure, but because I was just not aware of what was going on around me. So for me it was really hard because when you first get it done, if you turn on your side or you turn too quick, the air it comes out and then you feel sick and you feel nauseous. So for me, I had to sleep on my back, which was really hard, but it was too painful to sleep on my side or on my stomach. So that was something I wasn't really ready for. Not that you can prepare for that, but anyway, so I was on the drip. Obviously they have to keep you hydrated, and because you can't actually drink yourself they keep fluids running through you. They also had Panadol as well on the back of that, giving it to me for the pain. And then at any point, if I had really bad reflux, which I did, and nausea, they would give me a medication for that as well. And basically, like, it's really hard when you don't have anything in your stomach and you feel nauseous because you're not actually like vomiting anything really. Like, you're just gagging, and it feels like you're just like burping a lot. You're very gassy. So the doctor came the next day, and like, he said everything was fine. Like, obviously this is like my experience. I don't know if it's like this for everyone or if it's different. So but for me, he said that my surgery went perfectly, there was no complications, and that everything was fine. And I can really tell that on day 3 today, I can really tell that it did go fine, because like today I can actually drink. I was able to have dinner, or, you know, half a cup of fluid for dinner.